There are new travel rules today due to the Omicron variant. All international travelers are now required to take a COVID-19 test within 1 day of leaving for the U.S. Omicron cases have been confirmed in at least 17 states. All of them are mild as far as we know. There have been no deaths attributed to the new strain.
Now, the emergence of the Omicron variant could make testing for COVID more important than ever before. The Biden administration plans more testing with a focus on expanding access to at-home tests. CBS News medical contributor Dr. David Agus joins us now to sort this all out. David Agus, it's always good to see you. Let's get right to it about Omicron. We've heard about it less than 2 weeks now. Still so much we don't know as we sit here today. What concerns you most?
You know, on November 23rd in South Africa, the first cases of Omicron were reported, and now it is 75% of cases being reported in South Africa. So it is a 2 to 3 times more infectious variant, we think, or easier to spread than Delta. So that's really worrisome. There's some initial indication that it may cause milder disease, and it looks so. Younger hospitalizations, but many fewer. But that's early, and so we really don't know the impact clinically of this variant, but we're certainly worried that it spreads so easily.
And when do you think we're going to know something? We've had a lot of we really don't know conversation ever since we've heard about Omicron. When will we know something conclusively that we can make decisions?
You know, it's a great question. There's no lab test to tell you how much of a problem a particular variant will cause. The only thing we can do is actually look at the data of hospitalizations. So what we do know is that recent vaccination or booster will protect from serious illness. That data looked pretty good from South Africa, and that's somewhat encouraging. What we also know is that prior COVID infection with Delta gives little protection to infection. And that's obviously worrisome because there's a whole cohort of people in the United States that had prior Delta and said, I don't need a vaccine because I'm protected because I just had the virus. And what we're seeing with this new variant is that's not the case. So the good is there were over 1 million people who got boosters over the last day. So people are lining up, and Omicron is pushing people to get boosters and get vaccinated, which is what we need.
Good.
Now, Omicron was likely spreading in the U.S. before these travel bans were put in place. Why was there a delay on discovering this variant?
Well, you know, in the United States, we do testing, and then the samples are sent for genomic sequencing to look at the RNA and to say, hey, what type of virus is this? What variant is it? And there's a delay. There's just an inherent delay in how we do it. It's not real time. And so it will take a while for us to know the true extent. It is probably in most parts of the United States at the present time spreading. And what we're going to see is over the next couple of weeks, it will peak probably beginning of January to mid-January Omicron. So really what we're going to see is over the next 3-4 weeks, dramatic increase in the number of cases of Omicron. And it's a perfect storm, right? The weather's getting colder. People are getting together for the holidays. We all have COVID fatigue. Omicron is here. All of those things together really make it worrisome.
So, David, on top of that, you talk about people getting together for the holidays. The Biden administration plans to expand at-home testing. You know, Gayle and I were talking about this a little earlier. How confident are you that these tests are all you might need if you want to visit, for example, an immunocompromised relative?
I take a sigh before I respond because it's not that simple, but they are a very powerful weapon in the war on COVID. When I had my Thanksgiving dinner, we had everybody who came from the family. We did an antigen test before they came in. So what they do is they're not like PCR tests that amplify the RNA and so can be really sensitive to pick up for early COVID infection. What these tests do is they look for the presence of virus. So the people who have lots of virus or are symptomatic, they're going to catch. And that's very important because those are the people who are the biggest spreaders. A lot of virus, more virus to spread. And so the tests clearly work in that regard. So they're not perfect, but they're a big addition. In the United Kingdom, they started to do them, and they gave them out free to everybody in the country. And it was pretty dramatic, the number of people that were identified and then asked to stay home in quarantine until they tested negative.
Okay, I just worry about people administering them correctly, but that's a whole nother story. I wanted to talk to you about Senator Bob Dole, David, because I know you were part of the medical team. What can you tell us about that process, and what can you tell us about him?
he was an amazing individual. Obviously, he passed away at 98 years of age from advanced lung cancer. But right after the inauguration, I got a call from the White House who said, David, will you help the amazing doctors at Walter Reed Medical Center in the care of Senator Dole? And of course, I said I'd be privileged. Every interaction I had with him, whether it be by telephone or in person, was just him telling stories. And, he has such an amazing history and is a hero to so many people, and rightfully so, for what he did in World War II, what he did in the service of our country, and in fighting a cancer. It was, literally just a privilege to be in the room with him.
Dr. David Agus, always, we appreciate it. Thank you very much, sir.